Bowel cancer typically presents itself by a patient coming to me complaining of stool that is mixed with blood. So that is an alarming sign. However, there are a lot of other common non-cancerous diseases that can cause blood in the stool, such as hemorrhoids or piles, commonly known to people. The other symptoms that patients may describe would be weight loss because they are not eating so well, or they are tired. It's because they are losing a lot of blood, they become anemic, or tummy discomfort. So they may say their tummy feels bloated each time they finish eating. Also, a common symptom is change in bowel habits. I mean, somebody who has a regular bowel habits, going to the loo every single day with normal bowel motion, suddenly stops going for several days, then having diarrhea for the next few days. That's what we term as change in bowel habits. We try to encourage patients to go for screening before they even have the symptoms. That's because early detection will lead to curative treatment. So the gold standard for bowel cancer screening is a colonoscopy. So this involves a gastroenterologist or a surgeon who pass a tube through the back passage that enables them to have a good look at the whole entire bowel wall. In the bowel, they can do two things. One is therapeutic. That means if they see something that is not normal and easily resected, they can just cut it off during that procedure. That's called therapeutic intent. The other is diagnostic. This is when they see something abnormal, but they could not remove it completely. They'll take a tissue sample, send it to the lab for analysis. If the cells turn out to be cancerous, then the team of doctors will decide what to do with these abnormalities or the cancer cells. Colon cancer is treated by a team of doctors. These are the surgeons, the medical oncologists, and the radiotherapist. Before the surgeon will go in to remove the tumor, we need the radiologist to detect exactly where, if they were spread to other part of the body. If there are no spread to other part of the body, the intent of the treatment will be to cure the patient from the tumor cancer. So the surgeon will go in to remove the tumor, and usually we would find out during the operation lymph nodes or lymph glands are removed. If even one lymph gland is involved with cancer cells, that would give us the indication that the patient has high risk of cancer spreading to other part of the body. That's when a chemotherapist or medical oncologist come in to give chemotherapy. Chemotherapy is important in preventing cancer from spreading to other parts of the body. Indication for giving chemotherapy is, for example, during surgery, the surgeon found a very big tumor, or that the lymph glands have had cancer cells involvement. These are the indication that cancer cells spreading to other parts of the body or recurring in the following 2 years are high. So chemotherapy can be given in the post-surgery period, usually up to 3 months. That is the cutoff when chemotherapy becomes not so effective. When this is given during that period, then the chances of cancer coming back in the second 2 years will be reduced by as much as 30%. Radiotherapy is also important when the tumor is lower down in the rectal area. And if the tumor in the rectal area is big or there are lymph glands involvement, radiotherapy can be given in addition to surgery and chemotherapy to further reduce the risk of cancer recurrence more so in the local region. In conclusion, bowel cancer is very common both in women and men. We do have very effective treatment for early bowel cancer. More than 90% of early bowel cancer can be cured with the right treatment. So do go for bowel cancer screening with colonoscopy for all the people who are above the age of 40. This will lead to successful outcome if detected early.